So recently we just published a paper that showed that in long-term survivors, and we're talking about survivors who are 20 or 30 years out from their diagnosis, that they were complaining of new onset memory impairments. And this was kind of shocking to us because we've really focused on the treatment effects in short term, like 5 years from diagnosis. But now we're seeing that our cancer survivors are reporting new onset memory problems 20 to 30 years from diagnosis. So we begin to question what exactly is going on in this population. And so we designed a study to look at their brain and to see if their brains were actually aging at an accelerated rate compared to the normal siblings. And so what we did is we leveraged one of the cohorts that we have at St. Jude. So St. Jude has one of the largest pediatric cancer survivorship programs in the country. We have over 8,000 cancer survivors who come back to the campus for a 3-day visit. And in that 3-day visit, again, this is at no expense to the patients or their families, we'll do clinical investigations, we'll do echoes and pulmonary function tests, and just purview the whole spectrum of their health to see what kind of long-term effects they have. A subset of these patients also agreed to have MRIs done, and so we collected non-contrast 3D T1 MRI images, and we measured those using a technology called BrainAGE. And what this does is it measures the gray and the white matter volumes in the brains, and then compares it to a model of human brain aging that was developed using 30,000 normal healthy controls. And so then what we did is we took the BrainAGE score from each one of our survivors and then compared it to where they were on the spectrum. And of course, not surprisingly, we found that most of our cancer survivors, their brains were actually much older than their chronologic age. What was most surprising, I think, from this was that patients who had not previously received cancer therapies or cancer CNS-directed cancer therapies and cancer therapies that we know harm the brain, they were also had much older brains. Like Hodgkin's lymphoma survivors had much older brains. But the most dramatic result was that in young girls who were treated with chemotherapy or radiation that directed to the CNS, their brains were almost 30 years older than their actual chronologic age. Now, we've known for years and years that if you give radiation to a child under 3 years of age, that can be devastating. They have significantly lower IQs and they can have many, many more problems later in life. We were really shocked that now this seems to extend out to girls who are at least 10 years of age or younger. And so the next step then we wanted to look at was, do these changes in brain age, do they predict the neurocognitive outcomes? And yes, that's exactly what we found. We found that maybe a 2-year difference in brain age could actually have a clinically significant difference in working memory or in vocabulary. And that was the other shocking thing about this. Normally, as you and I, non-cancer patients, as we age, things like processing speed, how quickly you think, or your working memory, how much you can remember in a day, those decline as we age. And you kind of see that. Like, you're never going to beat a 13-year-old playing Fortnite because their processing speed's so much faster than your and mine. But as in our population, things that are normally stable over time, like vocabulary and word, in the cancer population, we were seeing correlations between brain age and loss in those functions, which is not a typical phenotype for brain aging. So it leaves a lot of interest, a lot of areas that we need to follow up to see, is this a normal phenotype for brain aging, or is this something specific to our children, and why?